computer. And then okay.
Monique, I just wanted to say hi.
Hi, Kate.
How are you?
I'm well, thanks. How are you?
I'm fine, thank you. And thank you so much for doing this. I'm gonna be in the background supporting Roshane with the questions and stuff like that.
Okay, talk to you later.
Okay. Yeah, bye-bye.
Bye-bye.
Okay. So, hi everyone. We will be starting shortly, in about a minute. We'll just give everyone a little bit of time to come to join in. Okay, so it's 7 o'clock and we can all begin. So, welcome everyone. Thank you for attending our Gutsy Learning Series event on navigating workplace accommodations in IBD. Let's go to the next slide. So, my name is Roshane, and I am the manager of research grants, impact communication, and evaluation at Crohn's and Colitis Canada, and I will be the moderator for tonight's event. So, before we kick off, let's go over some technical details. So, the session offers audio and video and slides, both in English and French. To access either language, select interpretation or click the globe icon in the menu bar below, and then you can choose the language of your choice. If you wish to see slides in English or French, please click View Options and then select English or French from the drop-down menu. If you encounter any technical issues, you can try refreshing your browser or restarting the webinar. Alternatively, share your concerns in the Q&A box and we'll try our best to get to you during the webinar. Next, I'd like to acknowledge the rich history and heritage of Canada's Indigenous people. While we meet today on a virtual platform, we recognize the importance of the lands which we call home. From coast to coast, we acknowledge the ancestral and unceded territory of the Inuit, Métis, and First Nations people that call this land home. Through this acknowledgement, we convey our respect for the traditional territories of the Indigenous community and contribute to the promotion of reconciliation. I'd also like to issue a disclaimer. The content in this presentation by Crohn's and Colitis Canada is solely for educational purposes only. While the information holds general value, it may not be applicable to specific medical situations. Online resources should not be seen as a substitute for personalized judgment and care provided by a trained healthcare professional. Crohn's and Colitis Canada does not endorse any external product or service mentioned during this webinar. For those of you joining us for the first time, allow me to share Crohn's and Colitis Canada's commitment with you. Our organization is dedicated to discovering a cure for Crohn's disease and ulcerative colitis. Through research, education, awareness, and advocacy, our organization strives to enhance the lives of everyone affected by these chronic diseases. Next, I'd like to highlight some ongoing efforts at CCC. We have launched the Unmet Needs Survey to be filled out by those affected by IBD. It's a 30-minute survey that captures our community's experiences, which CCC will then use to develop our programs that benefit our community the most. You can either scan the QR code or email us at learn@Crohn's and Colitis Canada for more information. Next, if you know someone with IBD, if you know someone with IBD, consider joining Crohn's and Colitis Connect, which is an online platform dedicated to those affected by IBD. You can join again by either scanning the QR code or checking out the link shared here, which is Crohn's and Colitis Connect .ca. Next, I wanted to share some information about upcoming sessions that are available for our community. This is specifically, we have peer support events provided on November 5th and December 2nd. And for our Francophone community, there's a dedicated French language event that will take place on November 18th. Again, you can access these by checking out our website or scanning the QR codes here today. So before we begin, I'm going to I'll be launching a poll, and the poll is just to understand how the knowledge scored throughout this before and after the webinar. So if you have the time, please take about 30 seconds to rate how your current knowledge about understanding workplace support and accommodation planning as individuals affected by IBD. And I'll give everyone about 30 seconds. Okay, I'm going to end the poll, and then I will share the results with everyone here. As you can see, for this question, it seems that about 25% of individuals, so most of the individuals are sharing it, a score from about 1 to 5, and then we'll run the poll again at the end and then see how the score changes. So thank you for taking part in the poll. Okay. Next, we will move on to the main portion of our webinar today, which is understanding how to navigate workplace accommodations when we're living with IBD. And the webinar today is led by Dr. Monique. So I really want to just briefly introduce her. So Dr. Monique is the scientific director and a senior scientist at the Institute of Work and Health, and she's also a professor at the University of Toronto. Her expertise lies in understanding how psychosocial factors such as stress, coping, and adaptation affect individuals' chronic health conditions. Her research focuses on the working lives of adults managing these conditions, and she leads important studies on workplace support, accommodation, and communication strategies to foster inclusive and supportive work environments. So we really want to thank Dr. Monique for being with us here today, and please take it away.
Okay, thank you very much. I really appreciate the opportunity to be here this evening, and thank you all for joining. What I'd like to do is tell you a little bit about some research that we've done to support workers with IBD and other disabilities and their workplaces, and then particularly focus on a couple of new tools that we've developed. Next slide, please. In terms of an overview of what I'm going to do this evening, I'm going to start by setting the stage a little bit, talk about disability in Canada, the numbers that we have from Statistics Canada, and what do they mean for workplaces. Then I'll move on to disclosure of a disability. Why are these decisions so difficult for people? How do workers make decisions, and can we help? And then I'd like to talk about accommodation planning, and particularly a tool that we've developed, the Job Demands and Accommodation Planning tool. Next slide, please. Okay, and I'm also going to give you my takeaway messages right up front. And they are that many workers do not share their health or support needs at work. The decision to disclose and making support requests are often complex and stressful for workers with IBD and other kinds of health conditions, and many of you are very familiar with that. Workers, organizational representatives, and healthcare professionals are often unclear about what to focus on in workplace discussions and what types of supports and accommodations might be helpful. So I'm going to talk tonight about, as I mentioned, two tools. One is the Decide tool, and it is aimed at helping people to consider whether or not to share personal information at work. And the other is the Job Demands and Accommodation Planning tool. And it really helps identify different types of demands that are challenging and then provides people with support and accommodation ideas. And there are different versions of the JDAP that I'll tell you a little bit about as well. Next slide, please. Although I'm giving the presentation this evening, in fact, I'm part of a very large group that has conducted this research and developed the tools. We call ourselves ACED, which stands for Accommodating and Communicating About Episodic Disabilities. And the team has a lot of different expertise. So we have occupational physicians, occupational therapists, physical therapists, clinical psychologists, ergonomists, communication specialists, health psychologists, really a wide range of people who've been part of the study. We've also got an expert advisory committee of individuals with various types of lived experience and really quite different types of jobs. And they've also helped develop the tools. Next slide. And a number of different groups have participated with us over the course of this research, which has taken a number of years. And you'll see from the slide that Crohn's and Colitis Canada has been a partner right from the outset. So very appreciative of all the help that they have given in supporting the tool and contributing to ideas, along with other various, mostly health charities for physical and mental health conditions. Next slide. And before I get into it, I will also acknowledge the funding, which comes primarily from two of Canada's federal granting agencies. One is the Social Sciences and Humanities Research Council of Canada, and the other is the Canadian Institutes of Health Research. We also received some unrestricted funds from Canada Life, Mars, and Employment and Social Development Canada. Next slide, please. Okay, so let's talk a little bit about disability in Canada, what the numbers tell us from Statistics Canada. Next slide. So we have about 8 million Canadians who report living with a disability. What's interesting to note is that about 61% of them report experiencing a disability that's episodic or dynamic. In other words, people aren't always experiencing limitations, but they have periods of time where they have flares or episodes. And as you know, that's very representative of what we hear from people with IBD. In about 23% of cases, people will report limitations or a disability that is getting worse over time. We have about 13% of Canadians who will say that their disability fluctuates and changes quite a bit daily or weekly. And then we have a group of people, about a quarter of people who will say their disability is recurrent. And so people may have a period of a month or more, sometimes years, where their condition is quite well managed. They have very few limitations to their activities. And then every once in a while, they will have some flares or episodes. What's important to remember, in addition to the fact that often disability is episodic, is that for many individuals, their disability is unpredictable and invisible. And again, this fits very much the pattern for IBD. So a person can be doing everything they should be doing to try to manage their condition, and they can still have unexpected flares. And often others aren't aware that a person is living with a condition unless they're told by someone about that condition. And I've put on this slide at the bottom a number of examples of mental health and physical health kinds of conditions, and there are many other examples. Next slide, please. So what does this mean for workplaces? Really, this changing and unpredictable and invisible nature of a lot of different disabilities creates challenges in two areas. And these are the two areas that we hear about the most commonly. The first is around communication, whether or not to share information, trying to protect privacy. And the second area is in providing support or accommodations to maintain productivity. Next slide. So if we were to try to put this in a fairly simple figure, although it's quite complex, often we hear from people living with conditions like IBD that they have a problem or a support need. And the two questions we've often heard most about are should I say something and what can I do? Next slide. And so that's really where we've focused our efforts. We've created these two tools, the decision support tool and the job demands and accommodation planning tool. And you'll see some links on the slide. There's at the top for the website with these tools, as well as the tools directly. I'm going to be showing these links throughout the presentation. You don't have to hurriedly write them down. And I will say right up front, they're freely available. We don't ask for information about you, so you can check them out whenever it's convenient for you. But I'll tell you a little bit about them this evening. Next slide. So before I get into some information about the first tool, Decide, I want to just talk a little bit about disclosing a disability, a condition, or the impact of the condition, and what we know about that and why those decisions are often so difficult. Next slide. So in research, we hear that anywhere from about 25% to half of people who are surveyed, and these are Canadian surveys because different countries have different legislation. So it's important that we have Canadian data. So between about a quarter to nearly half of people who live with either a physical or a mental health condition will tell us that they have not shared any information at all about any limitations or needs that they have at work with their supervisor. People are more likely to share with a close colleague. They're even less likely to share with human resources or others. And there are a lot of reasons for that. So in some of the research that we've done with nearly 900 individuals, about 437 of them in this particular study had said they had not shared any information. And they typically had a lot of different reasons. I think it's important to note that one of the most common reasons is that people can manage at work without others knowing. They don't feel there's really any need to share. People will say their health doesn't affect their ability to do their job. And I should mention that all of the studies I'm going to talk about tonight included people with IBD. Other times, people will feel others don't have the right to know. More concerning is that about half of people feel that nothing can be done, which is concerning because often there are supports available that might be able to help. But people will also have concerns about lost promotion opportunities, not feeling secure in their job, or even concerned that they'll lose their job or they've had bad past experiences. Next slide, please. So those are some of the reasons why people don't share. To be very clear, there's no right decision here in terms of what we see in terms of outcomes. So we do often hear from people who have shared information that the outcome was positive. People were able to get greater support, more understanding. But sometimes after sharing, we hear that people feel they have to prove themselves all the time. People are watching, or people can experience stigma or gossip or a loss of reputation. So sometimes people decide, well, then I won't say anything, and that can work out. It can be positive. People can have less stress, less concern about how others view them. But they can also have, of course, no support because they haven't shared any needs. And so they may feel that they aren't able to get the support they need for their job. And sometimes there can be misperceptions about reasons for job difficulties. And we hear this anytime conditions involve fatigue, a fair bit of fatigue or pain, or mental health conditions often. Sometimes people are sort of leaking signs that something's not right. And because others don't know what's going on, they sometimes jump to the conclusion that this is a person who lacks skills or they're not very motivated, they don't get along well with others, they're moody. And so, you can have these misperceptions about what's going on as a negative consequence of not sharing. Next slide, please. And so, when we look at these decisions in general, there are a number of reasons why people are struggling with making them. And I'm just going to talk very briefly about three. So first, there's the mechanics of what I'll call the mechanics of disclosure. You've got to think about, well, should I say something? Who should I share with? When do I say something? What do I say? Should I do this face to face? Should I do this over email? So there's a lot that people have to consider, and that can be really challenging. And it's usually not a one-time decision because a person's health obviously can change, their job can change, who they work with can change. So there are all these changes that often go on that mean that people have to kind of reconsider their decision over time. I've mentioned already that people aren't sure what the outcome will be. So there can be concerns. I'm going to lose, my reputation as a good worker. I will lose job opportunities for promotion, or there will be gossip in my workplace. Nothing I can do. And, we do see that that's not always the case. There can be positive and negative outcomes. And then finally, as you know, if you're in a period of time where it's a flare or an episode, it's really hard to know whether or not, what to think about. What information should I prioritize? Is there some way we can learn about how people make decisions to understand them better? So this last area, in addition to the other two, is also where we focused on in creating the Decide tool. So let me just give you an example of what we've seen in one of our studies related to that. Next slide, please. When we look at decisions, what we find is that often people feel stress or uncertainty because some information is encouraging them to say something, and other kinds of information that matter to them are sometimes discouraging them. So you can be pulled in different directions. So often people will use different types of information to make their decision. So people will think about the impact of their health and their need for support on their job. Have there been changes to, again, their health or work? Do you need support? Is there a safety concern for you or others, maybe because of medication that might make you drowsy and you feel you need to say something? People will have different goals. Some people want information, they want to get access to support, but often people want to avoid a problem. They want to protect their finances, their job, and keep the status quo. People will also have different preferences. Some people feel they have an obligation to share, they are happy to share, others value their privacy and want to control information. And of course, people can have positive and negative experiences. And then finally, people are trying to juggle information about their workplace. What might be available to them in the way of supports and accommodations, and how do they feel and think about their workplace? Do they feel it's a supportive place? Are they worried that they won't get the support they need? So as I said, people are trying to deal with all of this. Next slide. So we did a study recently with nearly 600 workers, and we looked at this information. And in this particular sample of people, which again included people with IBD, there were nearly half of people who told us that they had a considerable impact of their health on their work, and they felt they needed some support. People often said that sharing was helpful if they had accommodation or information needs. And in this sample, 78% of them said they had support available. So all of this information would encourage people to maybe say something about their needs in the workplace. Next slide. But at the same time, the goals that people held that were most strong for them, that were most important to them, often included protecting their financial security and protecting their reputation. There were about a third of people who said they were willing to share, but 37% were reluctant and 20% were really unsure, they were torn. And then 58% of people said they had a pretty positive culture in their workplace, but 16% were really unsure or ambivalent. They could see positive and negative aspects of their workplace. And 1 in 5, 20% of people said, no, the culture in my workplace really isn't a good culture for sharing information. I don't think I should say anything. And all of this information, of course, then discourages people from sharing. So when we look at how people actually make decisions, one of the things we found was, again, a lot of people had uncertainty. They really didn't know what to do. They didn't know how to go about starting to make a decision. And often people were prioritizing their concerns and worries over their actual needs. So they didn't want to do anything at all because they were worried about what would happen. Next slide. So that's why we moved in with trying to create a tool that won't tell you what to do, but will help people walk through the elements that you need to think about and support a decision that would be the best decision for you. And the tool, the entire website, the tools are available in both English and French. So let me tell you a little bit more now about the tool. Next slide, please. What we wanted to do was adopt a prevention and support framework. So help people to be more proactive and less focused on a crisis, because often when people are uncertain what to do, they wait, and then they find themselves where they are feeling forced to say something. Wanted this tool to be personalized and interactive, something that would be accessible and obviously evidence-based. There's a lot of information, sort of things to think about, pros and cons, but it doesn't really necessarily speak to your situation. So we wanted to work on that. Wanted the tool to be relevant to various types of health conditions and disabilities, different types of jobs, and of course, personal preferences. It needs to provide feedback because, again, out there you can get a lot of information about what to think about, but doesn't necessarily help you make that decision and can sometimes make you feel more stressed. And all of this was, of course, to improve the disclosure process. And it's important to protect people's privacy, which we hear from people over and over again is really important. Next slide. So if you go on to the tool website, what you'll find is you would select the English or French version of the Decide tool. You would read through the introduction that tells you a little bit about the tool, how it works, how it might help. And then you'll be asked questions about those 5 different areas that I mentioned earlier. So you'll answer some questions about what your needs are, what your goals are, your preferences, what you have available or not in your workplace, and what you think your work culture is like. The questions are fairly simple. They are answered with yes, no, or I don't know, or sometimes there's a statement and you say whether you agree or disagree with the statement. So you work through each of those 5 areas. Next slide. And after each area, you get the tool programming puts you into a category. So for example, if you were answering the questions about your work culture, based on what you say, the computer programming will put you in a category where either you responded mostly that the tools that you think your workplace, is supportive, or you think it isn't supportive, or you really see good and bad and you're very torn. So you get put into a category. Next slide. And from there, you get a summary, a short summary of here's what we're hearing about your situation. And you get some things to think about. So the goal is that the tool is trying to distill the information for you into more manageable chunks and have you think about next steps and the potential benefits and drawbacks of where you are. And this was something our expert advisors, people with lived experience, told us was really important. They felt that often they had waited too long, that they hadn't thought through what their decisions were. And so getting a little bit of, that might work for you, but here's something you might want to think about down the road was really helpful. So that's what the tool does. Next slide. So what you get is 5 different summaries. You'll get a summary after each section of the tool. And when you're done, you get all of the summaries and you can save that in a PDF for yourself. We don't save any information. So that is for you if you're interested in saving it. And you also get then some thoughts about some next steps, and you would get linked to the job demands and accommodation planning tool. Next slide. So the next steps, that will bring you back to some of that information I talked about earlier, the mechanics of disclosure. So if you're thinking after filling out the tool, I'm just not ready to say anything, you'll be given some thoughts about what you can do on your own, perhaps to get the support that you need. If you are thinking perhaps maybe I should share, you can get you'll get some information to think about related to, well, if you want to do this face-to-face versus email, what are some of the advantages and disadvantages? Who might be a good person to speak with? When might you want to say something? So you get some information to think about to sort of take you to that next step in terms of making a decision. So that's the Decide tool. And obviously happy to answer any questions about it. But I'll move now to accommodation planning. Next slide, please. All right. Before I tell you here about the JDAPT, let me run through a little bit about the research here that we have. And I'm going to talk about 2 different types of research, just very briefly. The first is research that we've done with people in a workplace who provide support. So we've done some qualitative research, and there's other studies out there with HR professionals, disability managers, occupational physicians, labor lawyers, union representatives, supervisors. And so we did some research to talk to them about what are the challenges you have in providing support to people who are living with various health conditions. All of these studies are available, and I'm happy to provide links to them later on. They're all open access if you want to read more about them. When we spoke to workplaces, there were actually about 7 themes that came up, but I'm just going to mention 3 here. One theme that came up from workplace professionals was, again, the culture of workplace support. Often we were hearing from people that they had a fairly medical model of support in their workplace. And what I mean by that is often workplaces were wanting notes from a healthcare professional to kind of verify and validate that this is real. Sometimes they wanted input from healthcare professionals on what could or could not be done with the work. But at the same time, workplaces were noting that this is not working well for them often. It's still often a step that they take, but it often delays the process. Not everybody has access to specialist care, or it's not always easy to get those notes. It often erodes trust because it's taking so long, and because you sometimes are conveying that you don't trust the worker. So people were talking about, or workplaces were talking about wanting to adopt more of what I'll call a social model of disability, where you really start to focus on the job and the fact that many of us will need, most of us will need accommodations or supports at some point, and how can we make the environment accessible for everybody? A second theme that came up from workplaces was that a lot of people had misgivings about the other people in the process. So you can have a fair number of people who get involved in support processes. Often there can be concerns about others' skills, training, their motivation and involvement. This is not the person with the condition. These are the other people trying to provide support. And so what that was meaning, well, let me give you some examples. Supervisors took a hit here quite a bit. They might be wonderful, but often they don't have training. And so there was a lack of consistency and transparency. If a supervisor changed, then sometimes the new supervisor said, nope, I'm not going to do this. They took a bit of, they were people who others thought needed some training and help. HR was sometimes seen as being there for the organization, not the worker. Union representatives are often involved when this becomes disciplinary, and so very late in the process when it's often quite confrontational. Healthcare professionals, clever people, but often don't understand the job. So there were all these concerns with different groups feeling that having some tools to help with accommodation and support planning would mean we could all start on the same page. And then finally, another theme that was very common is that because people have a tendency, understandably, to wait until they need help and not necessarily say something too quickly, formal communication often gets triggered by work absences. So people can find themselves in an attendance management or attendance support program where now you're sitting down for formal interviews with a supervisor in HR, explaining what's going on. And that means that planning is often reactive, it's not proactive, and disability is now being talked about as a performance problem and not as a support issue. So these are some of the workplace issues that were really driving the need for tools. Next slide, please. From the point of view of people living with IBD and other conditions, we heard, of course, as I've already mentioned, quite a bit about disclosure, that the challenges in making decisions. We heard that people were often unaware of what types of supports were available. There are resources out there. Some of them are quite good. It wouldn't necessarily occur to you with IBD to check out a cancer website or a mental health website that might have actually some great suggestions. So people struggle to find good information. Sometimes people feel nothing can be done if they don't want to share information, and that's not always the case. And of course, people can feel overwhelmed by their health and job demands, and they just don't know where to start. How should I start a conversation? How do I express what my needs are if I don't want to share too much information? Next slide. Sorry, next slide, please. So the bottom lines in terms of support planning that we heard about were that workers were really looking for guidance on whether to communicate and how to get support if they don't want to share information and what to share. Workplace professionals are really wanting something that's a transparent, consistent, and comprehensive approach that assesses something that they know is often quite complex. And they want it to fit with their existing processes, something that they can just kind of insert with whatever they have already going on. And of course, everybody would like to have more practical support and accommodation ideas. Next slide. So that's where the job demands and accommodation planning tool came in. And again, English and French versions. We want to try to help make the process smoother and more transparent. Next slide, please. And similar to the Decide tool, we want here to try to encourage people to have more of a prevention and support approach, try to be more proactive and less crisis focused. So even without a flare or an episode, you can work through the tool and think about it. As I mentioned, it needs to integrate with existing processes, give people lots of ideas for practical supports, be relevant to different types of jobs and conditions. We know that you can't always give everybody exactly what they need. So we wanted to have a lot of examples so people could kind of brainstorm and discuss on their own so that we could improve the process and really make a tool that's, again, interactive and accessible and evidence-based. So there are tools, again, out there, or there are websites out there. You have to work through them. And so we wanted people to just sit back and be able to answer some questions and give them some information. Next slide, please. So what the tool does is it focuses on work demands that may be challenging at times or regularly. It doesn't focus on a health or disability diagnosis because in Canada, you actually don't have to share details of your symptoms or your health diagnosis with others. You may be asked to provide a health professional note. That note also just needs to verify that there are some issues that can impact job. You don't have to share that you have a particular condition. What the tool does is then, rather than ask about that, it guides a person through a series of simple questions about their job tasks and their working conditions. And then you get a list that's personalized to your job demands of ideas to think about for support for any area that you say you're having some difficulty with. You can use the tool on your own, or you can share it with others to kind of work through solutions, what might work for you in this particular job. Back in 2022, we entered the prototype of the tool into an inclusive design challenge that was sponsored by Mars and CIBC. Mars is a venture capital group. And the tool won the grand prize that year, which was terrific, but we've been working on it ever since. Next slide, please. So I'll just walk you through how this tool works a little bit as well. There are 24 different job demands, and those job demands fall into 4 different areas. So you will be asked some questions about the physical demands of work, kind of cognitive or thinking demands of the job, working with others, and working conditions. And there are 3 versions. So there's a version that you can fill out as a person with IBD. There's a version that someone in an organization can fill out if they are familiar with the worker. That could be a supervisor or HR. It could be also a healthcare professional. They can do it on their own if they know the person well enough, or they can do it with the person. And then we were asked to also create a 3rd version. And this is a version that workplaces wanted. We were hearing sometimes we don't have a particular person with a condition that we're trying to deal with. We just would like to make our jobs more accessible and inclusive. And so you can fill it out, thinking of a particular job. Next slide, please. So for each of those 24 different job demands, the user will be asked, first of all, is this an important part of the job? If you say no, you move on to the next question. If you say yes, if you're filling it out for yourself, you'd be asked, are you having any difficulty with this particular job demand, some or most of the time? And then you'd be asked also, does it change? Are you always having difficulty, or does that sometimes vary? For the supervisor workplace version, or HR filling it out, they would be also asked, is this worker having difficulty, and does it change? They're not asked to attribute it to a health problem. So you'd fill out those questions, and then when you're done, you get a personalized report, and that links you to the strategies. And here again, you can save a PDF of all of the material. Next slide, please. So this is just a screenshot. I know you can't read it, but you would see a page like this that has you then choose the version of the tool that you want: English, French version, workplace version. Next slide, please. You then get asked, or you get the introduction page, which again, how does this tool work? How does it help? What is it not? So it's not legal advice, it's not clinical advice, a little bit about who created it. Next slide, please. Then you get in those instructions. So you're told you're going to be asked about the importance of this activity to your job, or whether it's important, whether you're having difficulty, whether that changes. We hear from people filling out the tool, again, especially if you have chronic pain or fatigue or neurodiverse people, the simple instructions are really helpful. There's a repetition here. People can fill it out fairly quickly because they know for each question you're going to be asked the same thing. Next slide. So sorry, I know this is very busy. I don't expect you to be able to read all of this, but these are a couple of screenshots, and you'll see one of the activities is doing activities that require physical endurance or stamina. So you'd be asked whether this is important to your job or not. If you're not sure what that means, there are lots of examples that you can see so that you can say, ah, yes, this is part of my job or not. You can write in extra job demands if you feel that they're not all covered, and you can save a draft and come back to it later if you get interrupted. Now, you can only save it for 72 hours because, as I mentioned, we don't save anything. We want to make sure this is private so the system is wiped clean after 72 hours. Next slide. These are, again, two different screenshots. Just a fictitious user here. If you'll see at the bottom left, it says 16 of 24. So this particular user has said that of the 24 job demands, 16 of them are relevant or important to their job. And then on the right, you see some colored bubbles. One of them at the top there says 8 of 16. So this user has said, of those 16 different job demands, I'm having difficulty at least some of the time with 8 of them, but they often change. 7 of the 16 are changing. They're not always the same. And then the other bubbles are basically the different job demands. Next slide, please. So this isn't the way it looks when you're on the website, but on the far left, you have endurance, a physical endurance or stamina. So if someone had said this was one of those 8 areas where they were having difficulty, they'd be given some strategies, some support ideas to think about. And there will be things that you can try on your own. So again, you're not really ready to share yet. You can try some things on your own. All of the job demands have some of these strategies. There are things that you could perhaps try at work to deal with this. You may or may not need permission for this. And then there are more formal accommodations that you would get ideas for. Next slide. For every one of them, there are some concrete examples. Again, we can't necessarily give examples or the strategy that will work for everyone, but we try to give lots and lots of examples so that you can brainstorm or use some of these more specifically yourself. Next slide. So now the activity on the far left has changed and it's concentrating for long periods. Now you get different ideas. So you would have different things you can do on your own, adjustments you could try at work, and formal accommodations that you can request, also with examples for every one of them. You can see that there'd be a lot already. And so if you know some of these aren't going to be possible in your workplace, you can actually click on the different strategies that are most likely to be helpful to you and create a personalized list with them. Next slide. And at the end, similar to the other tool, you can save parts of it. You can just save the strategies, all of them, or your own personalized list. You can save everything. We don't save anything. We don't keep anything on the website, but you can have a PDF. Next slide. So when to use the tool? We recommend that you use it early in a support process to really aid with assessment. We hear actually from a lot of organizations that this is really helpful to have people use this early on, and obviously on a regular basis to assess any changes. We get lots of good feedback from workplaces and workers. It really focuses the conversation on the job and not on worker personal characteristics. So it feels much less judgmental. It identifies areas of work that are sometimes omitted in other tools, like the interpersonal aspects of work and working conditions. And it just gives lots of concrete ideas that have really helped people. Next slide. So I just want to finish this evening quickly with a little bit about some evaluation of the tool. Next slide. So in creating the tool, we did lots of needs assessments. We looked at what was out there in terms of other resources. We looked at the evidence for different strategies. We did what's sometimes called a formative evaluation, where you look at you have people try out the tool and they test for its comprehensiveness, its length, and how easy it is to understand. We did preliminary outcome effectiveness, and we've done some implementation effectiveness. And I'll talk a little bit about that now. Next slide, please. Actually, sorry, I'll give you a couple of quotes from some of the early evaluation that we did. Sorry. So we heard from somebody, it seemed like you covered every piece, whether it was the physical piece, tedious work that's happening over and over again, or working long hours, traveling. So you have covered everything. That was a baker living with ADHD and a skin condition. We had someone say there were basically all of them that I go through in my job. It's basically everything I do at work. That was a truck driver living with Crohn's disease. And someone said, I go in and just say, I'm dealing with a mental illness. And my boss says, what do you need? And I say, I don't know. I think the JDAP might be better to help me understand actually these three aspects of the job are what are difficult for me. So let's think about what we do with those. And that was a government worker living with depression and PTSD. These are very representative of what we heard from people in the study. You can imagine I chose them because the conditions and the jobs were all very different. Next slide. We also did some outcome evaluation. So here we followed people for 9 months. We gave them a survey to fill out about their health and work before they'd ever seen the JDAPT, got some information. Then we gave them the tool, came back to them 3 months later and asked, had they used it at all? Was it helpful? Why or why not? And then 6 months after that, so 9 months from the beginning of the study, we went back to them again. There were 188 people, including people with IBD. Comments were very positive here again across disability types, gender, age, type of job. So again, people were finding the tool useful in a variety of different types of situations. People were using it over 9 months. We saw sustained changes in confidence, what's sometimes called self-efficacy, where people felt they were better able to solve their problems at work. They were reported being better able to meet job demands and deal with stress. We saw reduced productivity problems and less absenteeism over the 9 months. And most of these changes were highly significant, so unlikely to be chance. And most had effect sizes that were moderate to large. And what do I mean by that? You can have a change that is not chance, but tiny. You can also, not something you'd see, you can also have a change that is more noticeable. It's a larger change. And so most of the changes we were seeing would be larger changes that hopefully would be something that you could see. Next slide, please. Next slide. Sorry. So just a couple of quotes to finish up here. Someone said, it was empowering to see how much one can do on one's own, especially when I'm hesitant about being supported by HR. I use the list of strategies and accommodation plans, plus the language of the job demand summary to help me request a workplace accommodations plan. These tools were critical in helping me explain how my disability impacts my work and allowed me to think about possible solutions. Without the JDAPT, I wouldn't have had the confidence to go through this intimidating process and advocate for myself in such an effective way. And intimidating is their words, these were written comments. Okay, and last slide. Just to finish, I hope you'll try the tools. Feel free to let us know what you think. As I mentioned, they're freely available. There's no information that we're going to ask you about yourself to get access to them. You can, again, save your responses. We don't save the data. The JDAPT has been around for about 2.5 years, and Decide has been around a year. At the end of the summer, we did a look at the website. We'd had about 36,000 unique visitors, and we do know that some workplaces are using this fairly regularly, so they're going back, and so the uses of the tool are greater. And we've had visitors from a really wide range of countries, as you can see here. Next slide, please. So I will stop there and welcome your questions or comments. You can see the website, and you can also, please feel free to email me if you have questions you'd like to ask me after the talk.
Perfect. Thank you so much, Monique. That was super helpful. Thank you for taking the time to share your expertise with us to help individuals with IBD also think about how they would approach, asking for accommodations in their workplace. Okay, let's go next slide. So now that we've seen the talk, I'm going to launch the post webinar poll. That should now show up on your screens. Back. Okay, launch. So I'll give everyone about 30 seconds to take part. Okay, another few more seconds. Okay, I'm going to end the poll and I'll share the results. Monique, I'm sure you'll be excited to see that.
I'm delighted. I'm delighted. Thank you.
Yes, I know. I realize you're a little bit on edge waiting for these results, but it's really nice to see that, the distribution has shifted more towards like 6 to 10. And when we started, if you remember, we were around like 1 to 2 to 3, like 2 to 4. So these are great. Oh, yes, I will quickly share them. You can see that the distribution is now a little bit towards the upper end of the spectrum. So that's great. Thank you so much,
and
Dr.
it's not an easy decision. So I know that doesn't make it easy, but I'm glad people feel that maybe they know where to go and to get more information. So that's a good start.
Exactly, yes. So now we move on to the Q&A portion of our webinar. These are essentially questions that were sent in during the registration, and I've shared them previously with Monique, and then we will go over them together. Again, I do want to provide a disclaimer that we cannot answer questions about specific individual instances. These are more general answers. Okay. The first question is, when should an employee disclose an IBD diagnosis to their employer?
So the quick answer could be never, because again, you don't have to disclose a diagnosis if you're uncomfortable doing that. Personal health information is protected. And so if you need an accommodation or supports, you would maybe have to disclose that you're having difficulties. You could disclose related to a health condition, and it's affecting certain areas of your work. And so you want to talk about supports. So if you're uncomfortable, and sometimes I know people with IBD-R, and any other kind of condition, you don't necessarily have to disclose a condition. Now, having said that, sometimes people feel that it is helpful for people to know, or they want to educate their coworkers about living with a condition. And so the choice of when is not an easy one. We hear, for example, sometimes people will say, look, I'm living with IBD, as an example. I don't, it's not affecting my job. My condition's fairly well managed, but it does mean that at times I can have an episode or a flare, and this is what it would, maybe look like for me. And I want you to know. That really depends a lot, we hear from people, mostly on your relationship with people, and the trust level. One quick other thing, maybe I just said more about the who, and that sometimes we're hearing more and more from support providers that while people can have great relationships with a supervisor manager, and you might want to share information with them, if you need formal supports and accommodations, you probably do want to get HR involved, because again, supervisors can change. Or the job can change, and you would want often to, or you move, and you might want that plan to follow you so that you don't have to reestablish it if there is a change. So that would be my answer.
Thank you. Yeah, very called context dependent and very nuanced, depending on the situation. Okay, the next question is, what workplace accommodations are available for people living with IBD?
That will vary very much by the job. But in general, because a workplace doesn't necessarily think of different conditions, it won't separate IBD from anxiety disorders, from lupus. It can really, they just provide supports and accommodations. And what they want to know is what is the aspect of the job that's a problem. So there can be a wide range depending on the type of work you do. We see big differences often if a job is one where people have to attend in person,
Mm.
or a job is safety sensitive versus more traditional kind of or more office work kind of thing. If a job has to be there, you have to be there in person. Often they are public facing jobs, or they are jobs, in sectors where you may not have as big a range of accommodations. Where that really occurs too is if it's safety sensitive work. So if there's a risk to you or others on the job of your medication or other things, you might be told we simply can't change the work. We can't do anything about it. Whereas if you have other kinds of jobs, you might be able to do more. That can range from you can work from home, some or all of the time. You can have more time with breaks in the day if you need to. We can locate your job station in a different place, closer to a washroom where there's where there's privacy. We can reduce travel with your job so that you don't have to deal with that. So there can be really any number of accommodations, but this is what's going to depend on the job. One
Okay,
thing I will notice, sorry, Roshane, before we move
no
on,
worries.
just to keep in mind, you can suggest an accommodation to an employer. So you could say, for health reasons, it would be much easier if I were able to do my work from home. And you can certainly suggest that, but an employer doesn't have to grant you the accommodation necessarily that you want. They can say, well, you know what? We would rather you come to the office and we can put you near a washroom. We can give you more breaks and things like that, but we can't give you work at home. There is a duty to accommodate that employers have. They have to try to provide support, but they don't have to necessarily give you the support that you would like or the work arrangement that you would like. And if it's too much, they can claim undue hardship. In other words, now we're at a point where we simply can't, it's not viable for us to do this
Mm.
anymore. But most workplaces, I should say, over the years I've been doing this, I've seen a lot of changes where workplaces really are trying more than they used to sometimes to really help support people.
Thank you. The next question is, how can individuals advocate for their rights if they feel their workplace is not being supportive?
And that's a good question. There are a number of different ways. Again, many workplaces are very much focused these days on wellness and work-life balance, and often will have groups of workers who act as champions. So you could become a champion in your workplace to kind of educate people about different aspects of work. You can help focus on issues like accommodations and making work accessible. You can kind of get other employees involved in this. You can talk to HR or disability managers who should be aware of certainly legislation. Where this is maybe more of an issue is sometimes in smaller workplaces where you don't necessarily have big HR departments and things like that. And so just making people aware, sometimes that's the disclosing. You may not know it, but I'm someone who has been living with a chronic health condition for many years. It doesn't affect my job, my doing my job. And I just want you to know sort of more about what it's like for me.
Mhm. Okay, thank you. Um, there is a question in the chat that ties in with this, so I'll ask you this question first, and then I'll tie in the question in the chat.
Mhm.
So this question is, how should employees discuss returning to the office if hybrid or remote works better for them to support their health?
Yeah, so this is going to be something we're going to be hearing a lot about in the next year or so. Again, as we've already been hearing, a number of workplaces are saying they're going to order workers back to work. I do know that we're hearing from unions that they are going to fight some of this if you're in a unionized environment. I think the challenges here are going to be that workplaces are sometimes less persuaded that what happened during COVID, which was a necessity, is actually best for work productivity and workplace interpersonal relationships and so on and so forth. So they're going to want to start getting some data on this. And workers are doing the same thing. They're saying, look, it works very well for me. If I hadn't been able to get access to these kinds of supports, I might not be able to maintain my employment. And so I think workplaces are open to talking about this, about hearing about it, but you may have to kind of advocate for it in terms of what's on the table. So, for example, traditionally, a commute is your problem. It's not the workplace's problem. Now, workplaces are paying attention more to that, especially in larger urban areas where they know it can be hard for people, or if someone is living, for example, with IBD and they know that this is challenging, the travel piece. And so I guess the how should people discuss returning, I would go through a tool like the JDAPT and identify what the areas of work are that are challenging for you. And if some of those would be facilitated by being able to do some sort of hybrid arrangement or work at home. Um, uh, I think if you talk in terms of the job demands, it focuses the conversation on that and not on you.
Okay. Yes, thank you. So I guess the question I will tie in from the chat is, when does the tool take into account timing of disclosure? So is it risky, or is it better to do it during the interview phase or after you get
Mm.
the role? Or is there, I don't think there's a legal requirement, but yeah, so one question was about that. And then the other question was, is it risky to disclose? Like,
Yeah,
how do you manage the risks of disclosing?
So the Decide tool, thank you. These are excellent points. The Decide tool doesn't specifically focus on a hiring process. And that's an area where I would say we still don't have great evidence. But let me talk you through what we do have. There is a sense that if you know you're going to need accommodations right up front, and this is absolutely the situation for you, that sharing some information about those support needs is something that should be coming up earlier, not too late. Would HR, and I'm taking this from what I hear from some studies talking to them, will often say maybe not in the initial interview. Let's let this proceed to the point where like it looks like you're the person we're really thinking of. That might be the time, not, hi, I'm applying for this job and you should know I have IBD and this is how it affects me. That maybe you don't. There's not a right here, by the way, though. This is kind of what we're hearing from HR, what they think it's okay. You shouldn't wait until you've accepted the job offer to let someone know, and by the way, I can only work at home or something like that. So if, again, you know there are supports that you are going to need, it should be coming up at some point, as you're negotiating that job. If you're fine, if your condition is quite well managed, it has been for some time, sometimes HR will say, maybe don't say something right away. Wait until it's a little clearer that you need something. But you don't want to get in a situation where you're newly hired And then all of a sudden you're asking for a lot. Again, I'm sorry, I don't have a better answer, that there's not a best time. There can be a worse time, or not doing it at times might be bad. But there's no research out there right now that is telling us this is what you must do. In some countries, and Canada's not quite this way. In some countries, the legislation is if you need an accommodation and you didn't mention it at the time of hiring, that's grounds for dismissal. Even if it's something I could have done. That's why it's important to have Canadian studies and to understand our kind of situation. As I said, workplaces do have a duty to try to accommodate and support. Also have a duty to inquire. So if they see something has changed and you're struggling with work, they can't say, well, pack up and go. They have to say, is there something going on here? Is there something I can do?
Okay, perfect. Thank you so much, Monique. Um, the next question is, what kind of accommodations can be made in academic or teaching settings for people with IBD?
Yeah, so I'm just trying to now think on the spot about different aspects. So that's a type of job that is often in person. And so for some teaching settings where you have to be there, that limits or can potentially limit the accommodations. For some types of teaching positions, there is obviously online learning. We did that during COVID. I'm hearing from the education sector that, there are a lot of students, including in academic, and university, college situations where, hey, I'm paying money. I want that interaction with an instructor. I don't want to do online courses. Obviously, there are still online courses for distance learning and things like that. So that's certainly, the online is one situation. Another thing is sometimes the placement of where a lecture or a classroom is. It can be harder if you have younger people that you're educating, because you can't necessarily walk out of the classroom and take an unscheduled break and leave them on their own. And so, kind of adjusting a teaching schedule. Sometimes I hear people take on sort of more special roles. So I'm going to be a special education teacher because I can control more the work, or I'll ask for an educational assistant so I can do work. I know these are not necessarily things that the school system has the money for, but again, looking at the JDAP and ways to have more breaks to take care of unexpected issues, or just to plan where and how you set up your lessons and what you do might be ways to start to help.
Okay,
and sorry, I don't have more sometimes.
Are there new workplace policies or legislation in Canada to better support people with IBD?
So usually it's not condition specific. I would say, so it would, the legislation is usually intended to apply to a range of different types of conditions. I will say that legislation is more understanding now than it used to be of conditions like IBD, because they are invisible and episodic. At one point, the legislation was very much targeted toward permanent, constant disabilities, often visible. And now we have Statistics Canada recognizing episodic disabilities. There's legislation in play to try to look more at income support programs when you have a variable condition. A lot of that is yet to be worked out, but certainly the changing nature of a condition is something that is being recognized as real, as valid, in legislation. In terms of new workplace policies, we're seeing, again, I would say more emphasis on trying to provide inclusive and accessible workplaces and recognizing that that means sometimes changing the job, where it gets done, how it gets done, and listening to people to give them more control. And so I think sometimes the policies in a workplace are really geared toward that kind of, I guess, those principles, that kind of those values that matter, and then trying to work through the accommodations. Some workplaces have developed what are sometimes called passports. And so that's where you set up a set of accommodations or supports, often with HR and with HR involvement. And so if you move around in the job, you kind of have your passport with you, and so you don't have to renegotiate everything. So that's fairly new. Often workplaces that have passports, and governments are examples of that, they put a lot of the onus on you as the person to come up with the strategies. And so that's where the JDAP works really well with the passports, because it gives you the support ideas that you can kind of negotiate and then try to take with you. So those are just some of the changes, but we've got a long way to go.
Sorry, just give me 1 second. My screen split up here. Okay, here we are. Okay. So the next question is, how can schools or educational institutions support students or staff living with IBD? Similar to the previous question, but maybe we can answer it from the perspective of younger students.
Yeah, so there's probably a big education piece is the issue here, I think, probably for teachers and the institution, the educational institution as a whole, is just not understanding these conditions, not understanding when they might arise. That person who keeps leaving all the time. My gosh, you're leaving the room a lot. That I think that is largely something that is an educational piece. I think that's something really that Crohn's and Colitis Canada really could take on as a piece. I do know that in a lot of colleges and universities, for example, they are creating disability offices to help advocate for students. Often now it's not up to the professor to provide supports and accommodations. So you go to the office, you negotiate the supports there. You don't have to then tell all the different teachers or faculty what it is you're living with. You can just have those negotiated, and whatever it is you need, this person during an exam or whatever may have to leave. So that's one way that I think it's certainly higher education. Things are being negotiated. And if that's not available to you, it's something that I think I would advocate for so that you can arrange accommodations.
Yeah, that makes sense. The next question is, how can people with IBD balance frequent medical treatments, such as infusions, with their work schedules?
Yeah, and that's a not an easy situation, depending on, how this is kind of playing out in your life. I think that there sometimes there are more dramatic changes to work. Does this need to be part-time? Does this need to be a temporary leave of absence, or a change to a modified work schedule that would allow you to have a lot more flexibility? And a lot of that would depend on the workplace, I think, and the type of job. This is where sharing more information might be helpful if you trust the workplace, or if you have someone that you can go to so you can explain that you do have time that you need to have away from the workplace because of medical treatments, and try to negotiate something. I hesitate to say, oh, well, spread your day out over 10 hours so you can do work before and after some of the treatments, because that in the long run may just not be good for people because you just never get a break. I mean, we hear from people, I use up all my vacation time to
Mhm.
deal with my treatments and all my personal days. So I never have a holiday because I have to do that. It can work, but as a long-term solution, it's not good for your health either. And so this may be, as I mentioned, some where you need to think about disclosing, and you need to perhaps talk about a different type of schedule that could include part-time, if that's possible financially.
Mhm. Yeah, that's a tough
It's
situation
tough. It's very tough. Yeah.
to figure out. Okay, so before I wrap it up, we do have some questions that came during the webinar. So
Mhm.
we have a little bit of time, so maybe we can go through those. So one of the questions was, let's see, does the tool offer a way to search for accommodation examples by health condition? For example, can we search on help requesting accommodation specific for ostomy, for an ostomy?
Yeah, unfortunately, no. The tool is set up really to focus on the job demands. And so, if you have a sense of what kinds of demands might be affected by a particular treatment, you could look for that and then look for accommodations. But no, it was quite deliberately not set up for a particular health condition, although that can be very useful.
Yeah, that makes sense. Another question that we received is, I'll try to depersonalize it, but essentially this individual was saying that their job has changed. I guess the expectations of their role has changed, and now they're being pressured to adjust to those new expectations. How are they protected in the specific job, even although their illness and their accommodations needed are still the same?
Yeah, unfortunately not. If the job has changed, the employer can say, well, these are the demands of the job. If you can't do this, I can't accommodate. Now, often they will try to negotiate, but this is something that can be a problem for people. That's why often you are hearing people advising that you sort of negotiate with HR so that they can kind of set up something more formal that's in place that hopefully you could take with you as the demands of the job change. But most jobs have much more flexibility than employers or supervisors sometimes want to um, admit to. And so if you have job demands that are equivalent across the two jobs, and you were given accommodations for the other job that had these similar types of job demands, I think you can make a fairly strong case that, 80% of the demands are somewhat similar here. And I'd like to, and I was able to have these accommodations. Why can't I have them here? That would be how I would try to start thinking about it, is what are the demands, and are they really that different from the other job and the supports that I negotiated for that job? But again, there could be, where there's an expectation that you have to meet more with people, and this needs to be face to face. Or I mean, so there can be some changes, and
Yeah.
employers will say that's what the issue is. It's not your health that's the issue for them. It's the job demands.
Yeah, that makes sense. So I think we're done our questions, but I wanted to share a comment that came in that might be helpful. So in a previous question, we were asked, how do you manage, your work schedule with frequent medical appointments? And one individual shared that they have a compressed schedule, which allows
Mhm.
them to have certain days off for infusions. So basically, they work 9-hour days instead of 8, and every other week they have an extra day off. So maybe
And
that's something you can
yeah,
propose.
and that's a great great accommodation, to a great, opportunity to kind
Yeah.
of work that little bit of a longer day, but not extensive days all the time,
Yeah.
so that you can get that extra time off. Thank you.
Yeah, that's a
And
great
that may be in the tool. Sorry, this is very on the
yeah, as you
spot.
can
Yeah. So
yeah, of
if
course.
not, I'm going to be looking it up after because
Yeah,
yeah,
that's a
compressed
really
work
great.
weeks are common. Yeah.
That's awesome. Okay, so that wraps up the Q&A portion. Again, thank you so much, Dr. Monique, for, for sharing about the tools and then, staying with us a little longer to go through all the questions.
Thank you very much for attending.
Oh, yeah, that's also, we'll get to that. So that's me now. So thank you to everyone for joining us tonight. We really appreciate it. Really appreciate you taking the time. And we also want to thank our volunteers at Crohn's and Colitis Canada. This session was also cross-promoted with our volunteer community. So we hope they also found it helpful. If you have any questions or require further support, please email us at learn@crohnsandcolitis.ca. The video recordings of this webinar will also be shared to all the registrants via eBlast, and it will also be available online in about a week. So definitely go back and take a look if you want to rewatch the webinar. And we also want to share that our Gutsy Learning Series was made possible from grants from Pfizer, Janssen, AbbVie, Takeda, and Merck. Next, there will be a quick survey that will pop up as you leave this webinar. All the feedback shared there will help us improve and help us select our topics for the next year. So please take a few seconds to share your feedback in there. And lastly, you can follow Crohn's and Colitis Canada on any of these social media platforms. We're looking forward to seeing you in different places. So that wraps up the webinar for tonight. I really want to extend a heartfelt thank you to Dr. Monique and to our interpreters for tonight, who do an amazing job to ensure that we can make this webinar as inclusive as possible. And I'm going to wish everyone here have a wonderful night and have a wonderful weekend. Thank you, everyone. Take care.
Thanks again. Bye-bye.
Bye, Monique.